Good morning, everybody. I'm Terry Gerke, the Executive Director with Kentucky Diabetes Network. We welcome you to Diabetes Day at the Capitol 2023. Please do introduce yourself in the chat, and we will be beginning at 8:30. I have also dropped the agenda in the chat if you would like. Welcome to Janetta Haig from Lake Cumberland District Health. We're glad to have you. Welcome to Vicki Albertson from Lake Cumberland. We've got a nice presence, and Murray State from Evansville, Indiana. Welcome, everybody. It's wonderful to see you all. We've got interns, health department. Thank you all for being here. We appreciate it. We're excited for our conversation today. Do know that we've also got the live Diabetes Day at the Capitol next Wednesday, so we hope to see you all there. I will also drop that registration link in the chat later on this afternoon. It's nice to see you all. We're excited to be co-hosting with the Foundation for a Healthy Kentucky. You will learn more about both of us. Our goal today is to let you know that you can make a difference. And we'd love if you contacted your legislator and set up a meeting in advance for next Wednesday for Diabetes Day at the Capitol. We'll be starting our day in the annex and then sending you out to speak with your legislators. Good morning. I'm seeing several more people coming in. Welcome, everybody, to the virtual Diabetes Day at the Capitol, hosted by Kentucky Diabetes Network and the Foundation for a Healthy Kentucky. We're excited you're here today. You'll be hearing from several people, including Representative Danny Bentley, Julie Babbage, Executive Director of Diabetes Patient Advocacy Coalition, Gary Dougherty at the American Diabetes Association, Martin Richards at the Community Farm Alliance, and we'll be closing today with Ben Chandler. Dr. Connie White will be opening for us at 8:30 this morning, so stay tuned. We'll be starting in approximately 5 minutes. Welcome to all. Indeed, grab your coffee and get comfortable all. Good morning, everyone. We'll be starting in approximately 3 to 4 minutes. We appreciate you being here. Do mark your calendars for Kentucky Diabetes Network's quarterly meeting on March 3rd. We will be at the Foundation for a Healthy Kentucky. We appreciate them hosting us. Also, make sure you sign up for our event on the 15th, our live Diabetes Day at the Capitol. And schedule an appointment with your legislator. Good morning, everybody. We've had a few new people join us. Please feel free to introduce yourself in the chat. We appreciate you being at our Diabetes Day at the Capitol 2023. We'll be getting started at 8:30. We want you to know that you are important and you can make a difference. I have placed the agenda in the chat. Feel free to download that. We're looking forward to hearing from our group today. We've got Dr. White opening with the Kentucky Department of Public Health, and then we'll also hear from Representative Danny Bentley, Julie Babbage from the DPAC, Gary Dougherty from the American Diabetes Association, Martin Richards from the Community Farm Alliance, and Ben Chandler from the Foundation of a Healthy Kentucky will close us out. Thank you all for being here. We appreciate your participation. Good morning, everyone. As you're filtering in, I'm Terry Gerke, Executive Director with Kentucky Diabetes Network. We will be getting started in just a few minutes. There is an agenda in the chat if you'd like to find that. Good morning, everyone. We appreciate you being here. I'm seeing some more names come through on the chat. Make sure you introduce yourself. We are excited to have everybody here. We also do have slides, or pardon me, some other graphics that we will be presenting. So keep your eyes on that chat. Just a tip, and I'll be introducing our moderator, Merritt Bates-Thomas, in just a few moments, but do keep your eye on the speaker view. So I know we're all pretty familiar with Zoom at this point, but there are two options. I'm personally on the gallery right now, and it's nice to see everybody's face. When we switch over, you may want to go ahead and go to speaker vision or speaker view, pardon me. Dr. White wanted some coffee. I think I'm ready for another cup myself. All right, so with that, it is 8:30 and we want to respect your time. I would like to introduce Merritt Bates-Thomas at this time. Merritt is a very special person to me as executive director in KDN and has served with the KDN everything from president to now a member of our board. And we appreciate all she does to move forward the mission of Kentucky Diabetes Network and bringing to life the help for those that are living with or at risk of diabetes. Merritt.
Thank you so much, Terry. It is so good to see your faces this morning as once again we Zoom our way through Diabetes Day at the Capitol. We've been in person. The last time we were in person was in 2020. The last 2 years prior to this, we've been completely virtual. And this year we're trying something completely different. We're doing our virtual edition today to provide education and awareness information to you, diabetes educators, so that we can be more impactful with our messaging. And then next Wednesday, we will be back in person again, making legislator visits in the Capitol Annex. We'd like for you to reach out to your state representative and your state senator and make appointments to visit with them. If working in your schedule isn't convenient for a visit next Wednesday in person, take the time to find out when they might be back in your district and you can touch bases with them, because all the information we're going to be talking about today will be accessible through KDN's website. And for the first time ever, I'm excited to share that we have a one-pager with talking points from each of our speakers. So that information helps you have a more informed conversation with your legislator, highlighting the impact diabetes has on Kentucky for people living with diabetes and for people at risk for diabetes. It is now my pleasure to introduce our Deputy Commissioner for clinical services. I don't think I can remember a Diabetes Day at the Capitol when I've been involved, when Dr. White has not been with us. It's always a pleasure to hear her speak. And now, without any further ado, I'm going to turn things over to Dr. White to share the latest update on diabetes in the state of Kentucky. Dr. White?
Thank you so much, Merritt, and thank you, Terry, and thank you to everybody. If you look at this agenda, it's very exciting to see all of the different groups that we have brought together for this event. But I think it's even more exciting to look at the chat. We've got the leaders of diabetes in the state pulling together for this day, but more importantly, we have the leaders on the ground that do the work, that help the people, that touch the people, that look into their eyes and hold their hand as they're talking to them about their diagnosis, as they're talking to them about management, or as public health is talking to them about things they can do to prevent from even getting that diabetes diagnosis. So it's just an exciting day. And yes, I have been around for a lot of these, and I find it a very exciting time. I also wear purple because I can never remember the time that I wore blue. It was red day, and the time that I wore red, it was blue day. So I wear purple every time I meet with the diabetes folks. So I'm a little right and a little wrong. I'm going to approach this today in a backwards motion. Usually in public health, we talk about primary prevention, secondary prevention, tertiary prevention, but I want to start out with a big thank you to all of those people that have helped elevate our Kentucky prescription assistance program to the national level. We've talked about KPAP a lot of years, and it's gradually has gained a little bit of traction. For those of you who don't know, this is and I'm sure that it's going to be talked about later today, so I won't go into great detail. But when you see the commercial, if you cannot afford your medication, AstraZeneca may be able to help you. All of the pharmaceutical companies have a foundation that have money set aside to help fund people that cannot afford their medications. Now, to get that, you have to fill out a form that's in size 6 font. It's about 126 pages long. I'm exaggerating, of course. But it's just not something that most people will sit down and spend the evening doing. So many years ago, we were given a little bit of funding from the state, and we had someone develop a computer program. So if I, Connie White, walk into a KPAP office with my bag of meds, they can put my demographics into their computer. They can enter all of my meds, they can hit a button, and my application is filled out for every foundation that has the medication that I need. And that includes insulin. And then if you qualify, and some of them it's as much as 400% of the federal poverty level, you can get those medications either for free or greatly reduced. So our last year, we 8 out of our 10 top drugs in 2020 were medications that treat people with diabetes. So it's a great need, and it is rolling. And now, thanks to Julie Babbage, who you're going to hear from in a little bit, is going to tell us about the great work she and her team are doing, and the work that she's done with Stuart Perry, and how they have managed to make Kentucky's KPAP a national model. So we are very excited that we are getting calls from all over the country now saying, how did you do this? And how can we do this? And what do we need to do? So getting people that need insulin, I practiced OBGYN for 20 years. I saw people, nobody ever told me they skipped their insulin, or that they watered down their insulin, or they decreased their dosage. All of those things are deadly, and we know they're deadly. But I did see people doing that with their high blood pressure medicine and their other medications, and I think they just were afraid to tell me they were doing that with insulin because they knew that I would probably have lost my mind if they had told me that. But that was the best they could do. People do the best they can do with their little red wagon of ACEs that they pull into the room when they come to see you, and that's another presentation about adverse childhood experiences. But making sure these people that need their medicine is a passion for everybody on this screen. And I applaud you for doing this work. diabetes self-management and education and support. If we've got a diagnosis of diabetes, getting people to understand there are ways, and I won't say there's simple ways. Individually, they're simple. Added together, it's a lifestyle change. I learned at a call the other day, change is not hard. It's grieving what you're going to lose is the hard part. So changing to a healthier diet is not hard. It's grieving that you're not going to have those ever, you think, ever again. You're never going to have something. And if we can get people in these DSMES classes so they can understand that they can manage their diabetes, it doesn't have to manage them. I mean, what a revelation that would be for so many people in our state that are suffering with diabetes. And then stepping back into primary prevention, which is the world that we hope to live in, is diabetes prevention programs and any programs that help people. I'm not talking about everybody being a size 2 in their dress. The men may not quite get that, but that's not the goal. The goal is to lose a small amount of weight to make your body be able to manage their glucose load. I found a quote from a faculty member at University of Kentucky that I really loved. And she said that public health, part of what we do in public health is to imagine what we can do as a society and how we can create the world we want to live in. And that's where you guys are right now. You say, well, I'm just one person in, Connie County, Kentucky. You are creating the world we want to live in because you're talking to legislators. They work for you. They will listen to you. And I've been doing this for a long, long time, even back in my OBGYN days, working with the American College of OBGYN. We did lobbying all the time. I've never been anywhere where they had the education day separate than the lobbying day. And in fact, I didn't realize till yesterday that was what was happening. I almost showed up at the Capitol this morning. Thank goodness I read my email finally, and it would have been a lonely day up there. But I think this is just brilliant because when you show up at the Capitol at 8:30 after you've spent 30 minutes trying to find a parking place and walking into the building and going into security, and then you sit down and somebody does a fire hose thing with you for an hour and a half about do this, do this, do this, do this, and then you go out in the hall to find your legislator's office and you're just dazzled or bedazzled or whatever. I think giving you the information in advance, letting you hear people give you some tips and some ideas and some talking points, let you then marinate that in your head, you are going to be so ready next week to walk in there like professional lobbyists. Well, you won't be Julie or Bob Babbage, I guess. They have a little bit more experience than a week than you do, but you will have the tools that you need, and you will have, most importantly, the passion that you can look at your legislator and say, this is what I'm here about. You need to be crisp. You need to be short. I know they'll tell you that, but I'm here because I have a passion about this. And this is what I expect you to do as my legislator. Then what I would encourage you to do, and again, this may be covered later, is go back to see them in July or August. Because just as you're drinking out of a fire hose this morning, so are they. They started back today, and they've got a short session. So they're going to have people coming every 15 minutes telling them, I want you to do this, this, and this, this. They're going to hear that all morning. If they can know you on a day when they don't have their hair on fire and can listen to you, that's just that one more step for you to change the society the way that everybody on this screen thinks it should look like. So we're making great strides in our work against diabetes. Our numbers are tanking. We are continuing to have more people diagnosed, and that's good. That means we're screening more. So if the numbers are going up, don't be discouraged, because the more we screen, the more we're going to find. But finding those people and then giving them that hope that we can help you understand how to manage this. We can make sure that you don't have to skip your medications. Those are the things that you folks are doing. And we can offer their family members hope that with something like a diabetes prevention program, we can cut those people's chance in half of actually developing diabetes in their future. So we have a lot of hope to offer people, and it's just getting that megaphone out and magnifying that the scale that we can send this out. That's what you guys are perfectly positioned to do, more than I can ever do that. You are the people that can make this happen. So you're going to hear a little bit more about the diabetes report, I think, a little bit later, and about KPAP and about a whole lot of things that are happening. And I'm going to be able to stay on the whole time, Merritt. So I'll be here if anybody has questions later, or something comes up, or whatever fits into the, and I've got the agenda right here in front of me. I guess I could have looked at it. Just like I could have read the email yesterday. But we're excited that you are here today, because you are the basis of why we're here, to reach out for whatever your reasons are, whether it's personal because you have family, because it's you yourself, or just because you know this is the right thing to do. I'm proud of you to be here. I thank you for being here, and I'm going to turn it back over to Merritt so we can get started on our agenda. Thanks so much, everybody, for inviting me today.
Thank you, Dr. White. You may want to keep your camera on. I was scanning the attendees to see if I saw Representative Bentley. If we have time or need to extend your session, you can be the messenger around the state diabetes report infographic and the information that's shared on the one pager, and the two support each other beautifully. But right now, I'm going to ask Representative Bentley, have you joined our meeting? Okay. I do not hear
He's not on
him.
yet.
Okay, thank you, Ashley. So Dr. White, if you would like to talk for a few more minutes, just explaining the update to the state diabetes report. It is truly hot off the press. This infographic was brought to life because our state report is still being approved. And the infographic speaks to the one-pager talking points. But Dr. White, I'll let you take it away.
So for those of you who don't know, it was legislated that the state of Kentucky, and we were the first state in the nation to do this, and now almost every state is doing it now. We were legislated to pull together the Kentucky Department for Public Health, the Kentucky Department for Medicaid Services, the Kentucky Employee Health Plan, and that's the health plan that I'm on. So that's all of the state employees. That includes a lot of fire departments and sheriff's departments that are included. And it also includes our data people here at the state. Their name has changed a couple of times since that legislation went through. There's Representative Bentley. And so this report, we are required to get together as a group and discuss all the things that are happening in Kentucky toward diabetes prevention and treatment. And every 2 years, we are required to put together a report to the state of the status of diabetes in Kentucky. So I will go ahead and leave you in suspense about that right now, because I see Senator Bentley sitting down, and I don't want to take any time away from him. Good morning, Senator.
You gave me a pay rate. Can you hear me? Can you hear me? Can you
Yes,
hear me, Gary?
yes, sir. Yes, sir. We can hear you.
Okay, you gave me a pay raise. I'm a representative. I'm not a senator. I can't hear you.
I think I've already said enough. I'm so sorry, Representative Bentley.
I'm
I
happy
knew
where
that.
I am.
And
So,
we are happy to have you there.
yeah, thank you very much. House Bill, see, I've filed 2 bills so far. First one was House Bill 56, which is a community mental health bill, and then House Bill 141, which y'all know is Alex bill. So this is Taylor Williams. She's my intern from the UK College of Pharmacy for this session. And UK sent me over some fine people over the years, that's for sure, from the College of Pharmacy. But so that's the 2 bills I already have filed, and I'm working some more on PBM reform, critical care reform, and of course, I'm the only legislator on the OAAC, the Opioid Abatement Advisory Commission, and I sponsored that bill. So HB 141 is what y'all want to hear about. That's the urgent need insulin program. And I see Gary up there. He knows more about it than I do. I'll probably be using his bullet points. So I'll put it in a layman's term. 3 years ago, we did Kevin's Law, right? Right? Remember? So now we're just extending it to Alex's bill. So, you know, for those people not enrolled in Medicaid or CHIP or not enrolled in a health plan, they need some help too. So basically that's what it does. It limits the cost sharing on the insulin. Now, I also have in my drawer over on the floor another bill on supplies. I'm just waiting for the perfect time politically to present it. This session, they don't want any business because it's short session and they got their hands full. So you got to know where to wiggle in and wiggle out this time. So anybody got any questions? I know everybody there on that committee would already know more about this than me, probably. Somebody asked a question. Eligibility, I already told you about that. What else? Unless they spend $1,000. What else we got there, Taylor? On there you want to mention?
Rep Bentley, if when these advocates go out to talk to their legislators next week, what do you suggest that they say, and how do they approach that?
Well, a lot of them will be familiar because we had over 65 co-sponsors on this last year. And I hate to see it die, but that was a political thing too. First of all, eligibility. Make sure they know that it's for a certain class of people. 2, rural Kentucky. You know, here in Kentucky, you always got to hit that rural part because Kentucky is basically 2 states. It's Lexington, Louisville, Boone County, and Kenton County versus the rest of the state. And not even have people come up and say, Bentley, you represent Mississippi. And I get offended when they do that sometimes. But that's the way, you know, the Golden Triangle is usually rules everything. But I'm an advocate for Eastern Kentucky and for healthcare in Kentucky. I think I've proven that over the last 6 years. But eligibility, a Kentucky resident, and if they're not enrolled in those federal programs and they make less than $1,000, I mean, they spent less than $1,000. And then I got Gary's notes here. See, the individual shall submit to the pharmacy that application and that process of the pharmacy giving the insulin and get reimbursed by the manufacturer. Stiff penalty on the manufacturer. So if this goes through, I'm sure they'll go ahead with it. So that's the points I would make, especially for rural Kentucky. The reason I do that is because I don't know if you are familiar with my rural hospital bill in Kentucky. So that's where you had 50,000 or less in a county. You could borrow money from a fund we set up for either infrastructure for your employees or a new medical technique. And right now, and so we have about 124 hospitals here or there, and about 25% of them are in financial problems. This is rural. So now there's 6 to 7 hospitals on that, and we're getting ready to open a closed hospital back up in 11 months. I went by there this morning and they're already doing construction on it. So Bellefonte will open back up as a psychiatric hospital due to that. But what I'm getting at is rural Kentucky. See, we had to protect them because the way the balance is, Medicaid and Medicare and cash versus someplace like Boone County, you're top heavy and you're going out of business all the time. So if you hit them that way, we have 80 Republicans and 20 Democrats, but basically most of them are from, east of 75 or west of 65. So it's according to how you look at it. But that's what we're fighting for. Is that a good answer? Gary, I thank you for your support and Angela's support. I really appreciate it. Who else is up there? Jennifer. Hi, Jennifer. Merritt. Ashley. Are you still up in Ohio, Gary?
I am, yes,
Did Ernie Boyd, did he retire?
he did.
He did. Ernie's a good man. Good man. Gary's with the American Diabetes Association up in northern Ohio,
Mhm.
Columbus. So what else we need to do? Talk about pharmacist missed a claim. Then this gives them more time to get their insulin and stops people from dying of ketoacidosis. I don't know what else you can say with that.
Representative Bentley, this is
Yes.
Mary. I do have a question
Mary.
for you, and you've mentioned it is a short session,
Yep.
and there appears to be a very focused agenda where this legislation may not rise to the top of people's list of importance. How do you suggest we highlight how important legislation like this is? You've given us these key points, but is there one or two key things we can say that might get our legislators' attention?
I'm waiting for the agenda for Health and Family Services. I'm hoping both my bills will be on there because not many people will file many bills for HFS. So if this is on for Thursday, then we're in good shape. So I've already done the back door on that. So that and 56 both. And Kim's not against this. Kim's got a doctor for her husband. So she's always against things where it would take away from the medical profession. So that you got to understand where she's coming from. So, but it may be on the agenda this week. But if you're talking to the legislator, first use my name. Second, tell them there's 65 co-sponsors last year. And third, tell them they're saving lives. So it's taken me 6 years to get my name built up. I don't believe in, I believe in term limits though. So anyway, no, that's what I do. I go in and say, this is Representative Bentley's bill. And then I'd say this is going to save lives in Kentucky and rural, and especially in rural Kentucky. And then be sure to tell them there's over 500,000 Kentuckians, probably more than that have diabetes in Kentucky. And I think that if you go in to see them and you do those three things, they'll listen to you. So.
Thank you so much, Representative Bentley. We know you've got a busy day ahead of you.
I didn't know how busy it was. I had carpal tunnel done last Wednesday, so I wasn't supposed to be here. I'm supposed to be resting. So,
well, thank you for taking time out of your schedule to be with us.
Yeah, I just talked to Ben Chandler and Allison. They were just here a minute ago. So
great.
They do good work too.
They do.
Yeah.
We appreciate the collaboration with the foundation a great deal.
Oh yeah. We're working on a few other things. Maybe this time next year we have some other good news.
Thank you so much. Take care, Representative Bentley.
Thank you all.
We'll be in Frankfort next week. Bye.
Yeah, be sure to come see me.
Oh, we will. Thank you.
Thank you all very much.
Dr. White, we have just a couple of minutes. If you would like to highlight maybe a few of those numbers that Representative Bentley brought to light for us, if that's possible.
Yes, I'm trying to pull that up because I have given up using my memory. That is fraught with danger if I try to do that. So every 2 years we are required by statute to pull this report together. And I will say, when I first started in December, when this in 2012, and the first first issue was due in January 2013. And since that time, it has allowed our Kentucky Employee Health Plan to learn about DPP, and they now pay for DPP, they pay for DSMES, they pay for supplies through my state health plan. I mean, lots of good things have happened because of this legislation. But if you pull up that one pager that Merritt was talking about, I felt it important. We have a 10-page executive summary that's going to go to every legislator, and that is just the tip of the iceberg, because the actual report is closer to 70 some pages. So for people that are truly into learning and studying and policy and planning about diabetes, you'll want to see that full page report. It is a wealth of data about all types of things: diabetes by private versus public insurance, diabetes by age, hospitalizations, medication costs, race and ethnicity differences, is all in this bigger package. But when you're, again, walking into in a legislator's office, or anybody that you're talking to, you need this go-to one pager that can tell you what's in that report. And it tells you how many people in Kentucky have been diagnosed with diabetes, how many are predicted to have pre-diabetes, and how many people actually know they're pre-diabetic, and that Kentucky is 13th highest for mortality in the country. And that preventing diabetes, cutting that in half, I think that's really important. And when I first learned about DPP, it's the only treatment that I've ever heard of that works regardless of race, regardless of ethnicity, regardless of urban versus rural. The only difference in the DPP is if you're over 60, it works better. And I can't know of anything that for us over 60, I don't know anything that works better for us than it works for everybody else. So our team likes to say, if we could give you a pill that would cut your chance of diabetes in half, would you take it? Well, sure you would. This is a lifestyle change that will give you that without having to take a medication, with any side effects. There are no side effects to taking better care of yourself. It tells the people that you're talking to, you can tell them about estimated cost of diabetes in Kentucky, and that people that have diabetes do have a higher cost than someone without diabetes. This management of diabetes can reduce the risk. Everybody on this screen already knows that. That's not new news, but it is new news for people. I think we get so ensconced in our knowledge of diabetes that people don't really realize. They just think diabetes means giving yourself insulin and being sick. I mean, they have no idea the number of the blindness, the renal failure, the heart attacks, the strokes, and amputations are just devastating. And I've seen it in my family. So I think we don't want to forget that they don't know as much about this as we do. And that's why you shouldn't be intimidated. You are the subject matter experts on this. So you can walk into that room and know if that legislator is an attorney, they're an appliance salesman, they are whatever they are, they're a pastor, whatever their day job is, you are the diabetes expert, and give them that knowledge so they can make those right decisions, so they can understand why. Well, obviously, Representative Bentley's bill is something we support, because now we understand these risks of diabetes. And then the goals are listed here that have come out of our diabetes report, and you can read through those. We want to prevent new cases. We want to screen appropriately to find the cases that we're missing. We want to be sure people have access to those hopes that I was talking about. How can I manage my diabetes? We want to make sure that we are growing a workforce and an infrastructure, because we can't continue to have one-offs where we've got somebody doing good work over here and somebody doing good work over here and somebody doing good work over here. Number one, they don't know about each other. And number two, nobody else knows what they're doing. How can we connect all those dots, collect the dots, and then connect the dots to be sure that we're not doing extra work, but we're taking the work of others, we're magnifying it, we're multiplying it, and we're growing people that are passionate as we are about our public health reach, and train them to be able to do this. And then taking advantage of our IT. I know some of us just absolutely hate Zoom, and we hate this and we hate that, but man, we could not have gotten together in Frankfurt twice in a month. We wouldn't have all driven to Frankfurt for this meeting and then driven to Frankfurt next week for another meeting. So surveillance and collecting our information that we have about diabetes, because the more data we have, the more stories we can tell. And I know former Representative Chandler will tell you, I was in his office many years ago lobbying for ACOG, and I gave him my little numbers and my stats, and he sat there and he shook his head and he said, Connie, you're giving me data. I need stories. So we got to have the data, but don't forget, with this wonderful one pager and everything that's in that report, you are the ones that can supply the stories, and those stories are going to stick in that legislator's head, and then they can whip out this one pager or any other information that you may have given them as they want to support those stories. So does that help, Merritt? Does that give you what you need?
Perfect. Thank you.
In state government time, the report will be ready soon, and you can interpret that. But at the bottom of that page, there is a link to the report that is obviously not open yet because it hasn't gone through all the approval processes. But that report will be active soon. But everything you really need for what you're getting ready to do is on that page. That will give you the information that you need.
Thank you so much, Dr. White, for highlighting that for us. And thanks to our state staff who worked to pull that together for us when we realized that the state report would not be cleared for release in time for Diabetes Day at the Capitol. More to come, but I want to turn things over now to Gary Dougherty, our Director of State Government Affairs with ADA. And he will take what Representative Bentley shared with us about House Bill 141 and further illustrate what it does and why it's so important. Gary, I'll turn things over to you.
Okay, thanks, Merritt. I think I've got some slides that should be coming up here momentarily. And while we're waiting for that, I just want to share how excited I am about being with you today, but even more excited that folks will be gathering again in person at the Capitol next week. It's nice to get back to being live and in person again. Can we turn to the next slide, please? So to get started, I just wanted to reinforce a little bit about what Representative Bentley said regarding House Bill 141. This builds on the success that we had a couple of years ago passing legislation to limit cost sharing on insulin at $30 per 30-day supply. There are now 22 states plus the District of Columbia that have enacted insulin copay cap legislation. And I'll talk a little bit later about some of the successful efforts on the federal level as well. But since that insulin copay cap in Kentucky only affected state employees and those on state regulated health plans, House Bill 141 goes a step further to expand access to affordable insulin to those who are uninsured, underinsured, and anybody in need of life-saving insulin. So the legislation creates programs, as you can see on the screen, to help those who have urgent and ongoing needs for insulin. As Representative Bentley said, it's patterned after the Alex Smith Insulin Affordability Act, or ALEX law, that was passed in Minnesota. And it was named for the young man who, after aging off his parents' insurance, rationed his insulin due to its high cost and unfortunately lost his life to diabetic ketoacidosis. So a little bit more information about each of the programs. The urgent need insulin program would provide a 30-day supply of insulin to an eligible person who has less than a 7-day supply of insulin on hand. And then there's a continuing access to insulin program also that would require each insulin manufacturer to make a patient assistance program available to any eligible individual to provide insulin throughout a 12-month period. And importantly, Under both programs, the patient would be charged a monthly copay of no more than $25. Similar legislation, as Representative Bentley said, was introduced last session. It had 65 or so co-sponsors. Unfortunately, did not receive a committee assignment last year, so there were no hearings held on it. We are hopeful that it will be scheduled for a hearing as soon as later this week, perhaps. We'll be watching the committee schedule closely, hoping to get some momentum this month so that we can see that enacted into law, hopefully. I also want to reinforce what Dr. White said about personal stories. It's one thing for to share a one-pager or to share the data or to share numbers and so forth. That's all very good information. But what really moves legislators is that personal story. How will this affect me or my family or my friends and anybody else who is in need of affordable insulin? The personal stories are really what's going to drive the success of this, and frankly, any legislation. Next slide, please. So I mentioned that 22 states plus DC, including Kentucky, have enacted some form of insulin copay cap. And one of our goals since the first copay cap was enacted in 2019 in Colorado was to get the attention of our friends in Congress. I'm happy to report that some progress is being made. As of January 1st of this year, the cost of a 1-month supply of each Medicare Part D covered insulin is capped at $35 with no deductible. And then starting on July 1st, similar caps will apply for insulin used in traditional insulin pumps. I've included a link here to a Medicare webpage that gives a little more information, but that is that's the gist of what's happening on the federal level. We are still hoping to gain some traction with our friends in Congress to move some legislation that will make affordable insulin available to everybody. Next slide, please. So finally, I just wanted to encourage those of you who aren't already signed up to be an ADA diabetes advocate to do so. It's as easy as going to diabetes.org/advocate sign up. And once you're there, you can learn about what's happening on Capitol Hill and in Frankfurt and take action on issues that affect people living with and at risk for diabetes. Representative Bentley is an outstanding advocate for Kentuckians with diabetes, but legislators need to hear from their constituents about just how important House Bill 141 is. So I would encourage you, if you're not already, please sign up to be a diabetes advocate and get some more information about House Bill 141 and other legislation that might be coming through Frankfurt and Washington, D.C. that would benefit people with diabetes. And my last slide here contains my contact information. I encourage you to reach out to me with any questions about House Bill 141 or other issues that might come up during the current legislative session. I'll give you a couple seconds to jot that down if you like. And finally, I just appreciate you joining us today and wish you good weather and great conversations in Frankfurt next week. And I'll turn it back to Merit.
Thank you so much, Gary. I always appreciate you sharing your knowledge and expertise with us. Now it is my pleasure to introduce Julie Babbage, Executive Director with the Diabetes Patient Advocacy Coalition. Julie, thank you for joining us this morning, and I'll turn things over to you.
Yeah, thank you so much. It's great to be here and great to have another year and to be virtual, honestly, because it allows so many of us to join in the important work that you're doing. So thank you for that. Good to see a lot of familiar faces. I know we've got some slides that I think we're pulling up right now, but just briefly to introduce myself. Yes, my name is Julie Babbage, and I'm going to talk to you today about a bill that has yet to be filed, but is coming. And it's some work that we're doing around the country on this issue, but here in Kentucky especially. So I am actually coming to you from Frankfurt. So thanks to all of you who are joining from across the state, and let's get started. So just a little bit of background on the organization that I'm with, the Diabetes Patient Advocacy Coalition. So we exist because advocacy is not straightforward. We have so many passionate members of this diabetes community who want to be involved. In fact, we get emails all the time. What can I be doing? How can I share my story? What's going on in the, whether it's Congress or in states. And so we exist to try to make this process a little bit easier and more straightforward. We have lunch and learn style briefings where we talk about some of these big issues, some of the things that Gary has spoken about, some of the things that Dr. White has spoken about. We talk about them in depth. We have Hill Days in states and in Congress. We have just a lot of ways to try. We have calls to action where just with the click of a button, you can weigh in with your lawmaker, whether it's at the national or local level, on legislation that's important. So we have thousands of advocates in our network from all 50 states. We're really proud of that. We also have a sister organization, the Diabetes Leadership Council. Those are made up of people who have all served in leadership positions of diabetes organizations at the national level, who work on the front end of policy. So we really go hand in hand. We've got the policy aspect and making sure that laws are written in a way and bills are written in a way that really do the most good for people with diabetes, because sometimes that patient angle can get lost among the process. And then we have the advocacy side to actually push for that legislation to go through. So it's a little bit more about us. And next slide, please. So just briefly, our agenda today, rebates and PBM overview. Those may be words that you're familiar with, but we want to run through them, just what the problem is and some patient examples of that problem, what's being done, and importantly, what we can all do about it. So what is a rebate? A rebate sounds like a really good thing, and in some cases it is. In the case of the medical world, it has become a perverse incentive. And so what it ultimately is, you hear that list price or the price of drugs is being driven up over time. As we go to the pharmacy more and more, we're finding that our drugs are getting more expensive. There are so many factors that impact what that number ultimately looks like. But one of them that we want to focus on today is a rebate. And that is a financial incentive to buy a product from a seller. So in this case, a manufacturer makes a medicine, right? They spend money making it. They want to get it to as many people as possible so that they can then reap the benefits of that. And so they work with middlemen, with PBMs and with insurance companies to try to get that medication covered. And in order to get that medication covered, they're giving an incentive. They're saying, hey, it may cost X, but we're willing to give it to you for Y, right? We're willing to give you a rebate because you're buying in such volume. And because when you do that, we can reach as many patients as possible. And so it's really important for them to be able to do that. And it's really important for those middlemen to be able to do so at a lower cost. And so while it's important to those entities, it is not beneficial to the patient. And it's become even just a little carve out that should be what's called a kickback. It should be actually legal, but we specifically say in federal legislation that it's not. And so it's this really niche area that's going on behind the scenes. And we are just trying to make sure that if it's happening, that at least patients are going to get the benefit. So the example here is that at Costco, you buy in bulk to save. That's kind of what these middlemen are doing. They're buying in bulk and then they're saving money. But the patients are not saving money. So we're going to talk a little bit more about that. And the last thing I just want to mention is that this is impactful for patients across the spectrum. So I know our focus today is diabetes, and so grateful for that. People with diabetes don't just need insulin. And that's part of the awareness that we try to spread, is that Even Dr. White was mentioning KPAP. So many of the medications that KPAP is helping to make affordable, the Kentucky Prescription Assistance Program is helping to make affordable. It are not insulin, but they are helping people with diabetes and chronic conditions. And so if you're going to the pharmacy counter and you're getting a medication, chances are you're impacted by rebates. So what does a pharmacy benefit manager do? This is PBMs. You're hearing a lot about them. Congress is really interested in investigating further to understand exactly what's going on here in the middle of our system. And states are also looking into PBM practices and wanting to get greater transparency. Some of the work that PBMs are doing is helpful and essential to the system. But there are a lot of question marks around what is really going on behind the scenes in terms of profit, and how are some of those decisions being made, and what is the negative impact sometimes to patients. So a PBM negotiates drug pricing on behalf of a health plan, and we'll show you a little bit how those health plans and PBMs are related. They establish the formulary of the prescription drugs covered under a program. So that's when you call your insurance to say, hey, is this medication covered? Or your doctor tries to prescribe something that is covered. PBMs are working with health plans to make those decisions. They process drug benefit claims. And again, they are lowering prescription drug costs for a plan, and those two entities working together to pay as little as possible for the medications that they are giving to patients, but they are not always passing along those benefits to the patients. So that's what we're going to share with you about today. The lines are getting blurred between PBMs and health insurance companies. And you can see here that, you, for instance, Aetna, CVS Caremark, CVS Specialty, and then Minute Clinic, you're seeing a lot of vertical integration. And what that means is just more question marks. This is sometimes just how our country works. It's not always a bad thing on the surface, but when it starts to impact patients and when it starts to impact drug pricing and so many other facets of our medical system, questions need to be asked. And again, that's what so many states and Congress are working on. Our angle is specifically making sure that patients are involved in that conversation. So what is the problem and what exactly does that look like? We show this slide a lot. This is actually courtesy of the American Diabetes Association. So thank you, Gary, for your work to try to show how our system is flawed. The challenge here is just that there are so many hands touching the process, but between the manufacturer actually making the drug and patients actually receiving the drug. And each time it's changing hands, that cost is going up. And so we have a flawed system. If you were designing it from the ground up today, you would not design it like this. But this is what it has morphed into over time. The slide is intentionally confusing. We call it the hairball slide. It's just meant to show you that there is a lot going on in this process. Next slide, please. So rebates are driving up prices a lot of times for patients. And what you're seeing on average is that cost is increasing about 48% for patients. So in the process of the medications going up, the reason is because what's happening is that rebate, that discount that's being given, is around 50% of the actual cost of the drug. And so that each player has to raise the cost of the drug to try to break even from those rebates being offered. I know it's a little confusing, but we're going to get into a specific example here in just a second. Just pointing out again that there are other conditions beyond diabetes, and people with diabetes may have other conditions that are important just to note that rebates are impacting so many medications in this process. Next slide. Okay, so here is an actual example. We talked about 48%, so we're using round numbers here. So you see that the list price of a drug, so that's the cost that we associate with the medication that we're going to the pharmacy counter and buying. So the list price is $100 of your drug. That rebate, around 48%, is $48. That means that in order to get that drug covered, manufacturers, PBMs, everybody's trying to play this game. How much of a rebate can we offer so that our drug is the preferred drug or goes onto the formulary, gets covered to reach the most patients? So those rebates are getting steeper. So they're getting bigger discounts, right? So $48 of a discounted price. That means that the manufacturer, despite charging $100 for the drug, or despite the drug being listed at $100, is getting $52 because they've given that rebate, that discount to the PBM and the insurer, again, which oftentimes go hand in glove. So that insurer got the drug instead of $400, they got the drug for $52. But what happens is you as a patient come to the pharmacy counter to get your medication. And instead of your medication costing $52, you're paying $100. And what we like to equate that to is you pay for your Sam's Club membership, right? You pay your premium to get the privilege of having covered medication that should come at a discounted price. But you're not getting the benefit of the discounted price that was actually given to the folks who are selling you the drug. So that's frustrating because not only are you paying more than you should, but we're losing track of all that extra money. So the profit in the middle is going up. We are paying more than we should have to for the medication. And that's why you see a lot of these questions being asked. So with reform, you see on the other side that what a PBM or insurer would do is they would say, we got the benefit of getting this drug at a discounted price. So we're going to give that benefit to our members, the people who pay to have insurance. We are going to pay us, right? Pay a premium to have insurance. We're going to give that same cost access to them. So we paid $52, we're going to let them pay $52 for the drug. And we're not going to charge them just because they're in their deductible period, what that list price is. And so hopefully that's going to be coming a little clearer now that we've talked about a specific example, but we'll have some time for questions at the end, or you can type them in the chat. But this is what we're going for, is at least 80%. So in this example, it's 100% on the right-hand side, but at least 80% of that rebate, that discount, should be passed through to patients. They should get the benefit of at least some discount if everybody else got the benefit of the discount in the middle. So another challenge of this perverse incentive is that the lowest cost drug is more and more not winning. You would think that if there is a lower cost alternative available, it would be covered for your plan, and you would probably be offered that just right off the bat, right? Hey, there's a lower cost drug available. You don't need to go for this higher cost drug because it's a generic, because it's a biosimilar. If it's insulin, if it's a complex drug, it's a biosimilar. If it's a single molecule or simple molecule, it's generic. So those words can somewhat be interchangeable. But all that to say, these generics and biosimilars are not getting covered because, if you think about it, if the drug example was $100 for a list price, their list price may be $20. Well, they can't offer a $48 discount, or they're in the negative. And so what is happening is folks in the middle are saying, well, when we look at these two side by side, we are getting a much better deal from this really expensive drug than we are getting from this inexpensive drug. Maybe the drug is $50 and they're selling it for $50 to the insurance company, again, $52. So you're sort of, you're boxing out these cheaper drugs in the process who can't offer as steep discounts because they're cheaper to begin with. And what that means is that they're not getting covered in the way that they should be appropriately covered for patients to get access to them. This shows up in terms of non-medical switching, where you get a letter from your insurance company that says, hey, you were taking X, now you're taking Y. And you think, well, but X was working just fine for me. Why do I have to take Y? And a lot of times that's because the insurance company and the PBM has gotten a better deal from another medication, and they've switched you. And it wasn't your doctor and you making that decision. It was your insurance company and PBM making that decision. And that's something that we think is bad for patients. So what is being done? We're going to show you on this slide that there are a lot of states looking into this. A lot of them have PBM transparency bills where they want to understand exactly how much money is being sort of held or kept in the middle. Ohio had a big case where they exposed this and found a lot of millions and millions of dollars in the middle that were sort of unaccounted for. And so other states are really interested in understanding the dynamics of the financial aspect. But our angle is going to be, no matter what you're finding, make sure that patients are going to benefit from what you're doing. And so as you're looking into PBMs, and so many states and Congress are, really make it a point to be sure that any changes you make are going to help patients be able to have access to more affordable medications. So we call that rebate pass-through. That's that discount that's being passed through to the patient at the point of sale. And that's what we're working on in so many of these states. West Virginia was actually the first to pass this bill. So our neighbor was first to the punch, and now so many states have this legislation. Now, there are some challenges associated with it. There's always, there's pros, cons, there's big entities and lots of money, at stake. So there are folks that fight against these bills in these states. We're obviously fighting for them. And again, for the good of patients and access and affordability in the process. So Kentucky is one of the states that has filed this legislation. It is always an uphill battle when you're dealing with these giant corporations. But we have a lot of hope, especially because our sponsor is Chair Steve Meredith. He's the Senate Health Chair. And so he has just been such a champion for people with diabetes, people with chronic conditions. And he has said, I will carry this bill. So it's great to have somebody with his caliber, his position of leadership, his heart for this issue at the helm. And, we hope that we can make some progress this session. We filed it last year too. And we hope to just, again, be able to get a hearing and be able to discuss it. We've had a lot of conversations too before session started. Obviously, as has been mentioned by several folks, including Representative Bentley, Dr. Bentley knows firsthand, like this is a short session. And so he's being very strategic with how he works on things. And so we'll do the same. We'll really do the best we can to push it this session. And the thing about advocacy is sometimes we have to come back year after year. And so if we need to do that, we will. Next slide, please. So we talk about sometimes just the impact of this legislation. I mentioned Dr. Bentley, and it's a really great moment just to say thank you to him, if he is listening, that so much of the work and the progress we've made over the past few years as a diabetes community have been legislation that he sponsored. And whether it's Kevin's Law, which he mentioned, which is emergency access to insulin, where your pharmacist can actually grant you access if you drop a vial or something and last minute need something just to bridge the gap between your next prescription. So he's done that. He also worked on the copay cap bill along with other folks, and that was really great legislation, but it only impacts so many people. And there's only so much that state lawmakers can do when it comes to helping all Kentuckians. And so just a note on who this bill would impact, who, if the state, goes through with what we're calling this rebate reform, who ultimately does that impact? And so it's individuals on exchanges, the fully insured employers, and the state employee health plans. So important note at the bottom that ERISA plans and Medicare participants are excluded because the jurisdiction there is federal. And that's a good chunk of folks. And so we are working at the congressional level too, to make sure that this is something that people are paying attention to help as many Kentuckians and as many Americans as possible. So what can you do? There are a lot of things you can do. First, I think Merritt said at the start that FaceTime with your lawmaker is so important, whether it's in district or in Frankfort. And I have to give a shout out again to Katie Ann for helping to facilitate and encourage that relationship building. And I want to specifically mention Ms. Kay Peterson, who is on today. She has developed a relationship with her member of Congress, who she met with directly in DC on an advocacy day that we had, Representative Comer. Representative Comer, by the way, has an elevated role as chair of oversight. And so if you want to talk about somebody who is going after this issue of middlemen and what's going on head on, it is absolutely him. We are so thankful for the work that he is doing on behalf of Kentuckians and frankly, on behalf of the country. And so, as Kay met with him and we were able to watch firsthand, I am a Kentuckian, but I'm not a constituent. Kay is a constituent of Representative Comer, and hearing from her and her sharing her story was so essential. So it's like Dr. White said, when you're the expert when it comes to diabetes and what it looks like to live with diabetes or have a child with diabetes or whatever your experience. And that's really point number 2. What can you do is to get comfortable telling your story in a succinct and respectful way, because that is what lawmakers are going to remember. That is what ultimately motivates them to act. And so it's a really good thing to practice. Another thing you can do is joining events like today. It is such a great way to be empowered and to come together as a community. You've got multiple organizations on the line. You've got multiple patient advocates and patient champions working together. And when KDN can bring us together and help us to coordinate to be as effective as possible, that makes a huge difference. So when we work together across all these organizations and patients and parts of Kentucky, that's when we can be the most impactful. And just also knowing your resources that are available. DPAC is available if, to share more on rebate reform, if that's something you're interested in learning more about. We have a YouTube page, a lot of explainer videos on this and other subjects. Another resource that Dr. White mentioned at the beginning that is truly a national model, Kentucky is leading the way, is the Kentucky Prescription Assistance Program. We're talking about drug affordability. It's impacting people at all levels. And KPAP is really helping to bridge the gap across medications, right? Not just for people with diabetes. So tell your family and friends. And they have so many other services that they do. They can even help you to sign up for Medicaid if that's something that's applicable. It's incredible what they're doing, and it's not like it's a giant staff of folks. It's a very small team, but they are so impactful. So knowing what resources are available to you in the meantime, whether it's websites or days like this where we all come together and get to empower ourselves with knowledge. And when you are in Frankfurt, if you come to Frankfurt, if you're meeting with your lawmaker, the goal, I think, is to get that rebate reform bill filed this week. So I don't have a bill number for you yet, but mentioning that that's something even that you're aware of. I think sometimes these big players, they benefit because these issues are so complex and they think, oh, patients aren't going to pay attention to this. We can get away with it. And that's not the case because we're learning more and more about it and able to share that with more and more folks. So we raise our voices together, we can do a whole lot of good.
Julie, thank you so much. We have the absolute best partners for Diabetes Day. So again, thank you to Julie and Jacob and the team at DPAC. We appreciate the knowledge they share with us. Gary, thank you so much for your work with ADA, and Dr. White for always getting our Diabetes Day started off with the latest there is to know around the data that can help us tell our personal stories. Now it's my pleasure to introduce a new partner we're bringing to the Diabetes Day at the Capitol table. Martin Richards serves as the executive director with the Community Farm Alliance. So I'm going to turn things over to Martin for him to share a bit about his work and why he is with us today for Diabetes Day at the Capitol. Martin, welcome.
Thank you. Thank you very much. I'm going to share my screen here. I hope you all can see that. Can you all see my slide? I see a few heads. All right, I think I'm good to go. Thank you very much. I'm really delighted to be here because, unfortunately, like so many folks, diabetes has affected folks in my family, and it hasn't affected me personally. And but I'm very appreciative of this work. So yes, as I'm Martin Richards, Executive Director of Community Farm Alliance. I often say I'm a recovering farmer, and I joined Community Farm Alliance when I was transitioning our traditional tobacco farm into organic agriculture. I'm going to give a little bit of background about CFA. So get it to advance. There we go. So CFA was formed during the farm crisis of the 1980s. Farmers, actually the first thing that happened was a group of farmers hosted a suicide hotline for their friends, their families, their neighbors who were just distraught about the idea of losing their farms. And the next thing they did was create Community Farm Alliance, because they felt that they did not have a voice in what the policies that were affecting them. And so at the heart of what So at the heart of what CFA does is leadership development and community organizing. I mean, we feel like folks who are on the ground know their problems, and they often have a pretty good idea of how to fix them, but don't know where to start. So CFA helps them organize leadership development, bring a voice and a face to the issue, create the partnership. And one of the unique things I found that we do is we also create models that directly address the issues that folks are facing. So programs or models that we can also, directly impact, address issues, but also take them to Frankfurt or Washington and say, hey, you pass this bill, you make this appropriation, this can happen for everybody. So we're facing, for an ag state, or what I still think of as an ag state, the idea that we have hungry people in Kentucky is just appalling. But it is an issue, unfortunately. The numbers are just not, they're not encouraging, right? Especially that, 1 in 6, I think that's been lowered to maybe 1 in 5 kids are going hungry in this state. And one of the things is, like, not only are folks, don't have enough to eat, but more often than not, folks are starved for nutrition. And we've got this situation where, lack of access to good nutrition, we're facing the consequences, honestly, of about 40 years of food and farm policy in this country that was focused on just producing cheap calories. And so, now we face these consequences, and you all are so well aware of this, right? Being that diabetes is one of those consequences. In the statistics, again, you all know these well, but the amount of folks in Kentucky who are obese, overweight, and don't consume enough of the good food that we should all be eating, myself included, to be honest with you. And consequently, that Kentucky ranks, in the bottom compared to all the states for all these, nutrition-related health issues. But there are some good things happening, and a number of efforts here in Kentucky that are attempting to address these issues. And for Community Farm Alliance, we have Kentucky Double Dollars, Fresh RX prescription for mothers on Medicaid, expecting mothers on Medicaid. And the Kentucky Food Action Network is a broad network of organizations and individuals who feel like they have a stake in the food system in Kentucky and want to change the way we are approaching this. So, you probably have already heard this. It's become the new kind of buzzword of food as medicine, right? But I think it's the growing recognition that what we eat has a huge impact on our health. And, the changing or the prioritizing what we do can have an outcome of all this. And there's, again, these 3 basic buckets that not the only ones, but the basic buckets: medically tailored meals, just general food assistance, including access to healthy food, and then incentives for people to eat healthy. And I think there's also comes with this growing recognition of the impact. And for all of you who are working in the policy world, it is really the economics that drive everything, whether it's Frankfurt or Washington. But the fact is that, improving food access and improving public health are really good economic development. It's one is offsetting the cost associated with, with on the back end of healthcare, as opposed to on the front end. And the managed care organizations, WellCare and Passport, have been supporting CFA's efforts, and and because they see it, right, the numbers, that it is more cost effective to support the access to healthy foods up front than it is on the back end for all this. Within Community Farm Alliance, we have the umbrella of the Healthy Communities Initiative that we do this work. And of course, you know, we came to it because we want to increase sales for farmers, right? Especially small farmers who, like myself, were transitioning from tobacco and chose, you know, fruits and vegetables to replace tobacco as part of that effort. And again, you know, we have a number of programs that we address with food access, helping do community food system assessments at the community level, and then, you know, helping cooking classes that are woven into kind of all the programming work. I think the three big programs that we do that directly affect this are Farmers Market Support Program. And all these, like the Farmers Market Support Program, we started that, you know, in 2014 to support farmers markets, you know, including helping those farmers markets accept SNAP, as well as senior and WIC farmers market nutrition programs, and then doubling those benefits up through Kentucky Double Dollars, then making healthy food more affordable and more accessible through that. And then, you know, most recently is this prescription program for mothers on Medicaid that, because I think overall, I mean, I think we all want to do this, right? It's creating this culture, you know, of eating better, eating healthy, and, you know, what better way to do that than starting with the expectant mothers, and then, you know, creating that onset that throughout the whole family as that child grows up. And, you know, we are selling like Kentucky Double Dollars. The amount of redemptions is just continues to grow and grow as more people become aware of it. Funding is available through that. We are very proud of that work. So what does it look like down at the community level, which is, you know, where the rubber meets the road, so to speak? So this is just one example, Perry County Farmers Market. You know, not only are they doing Kentucky Double Dollars and Fresh RX, but, you know, they have worked with the local health department and other organizations. They have the diabetes dollars, the carrot cash, you know, they do, you know, cooking demonstrations, and are really focused on, you know, making sure that low income folks have access, so that there's this really building equity into the whole food system from the ground up. Question is, I think just as Julie asked before, can we do more? And of course we can do more, right? We're just beginning to scratch the surface. I think especially around this idea of prescribing food for it. But, you know, not only from CFA's experience, but, you know, other programs in the state and across the country, there are challenges, right? You know, scaling things up, growing it to meet the need and demand out there for these programs, creating sustainability so that folks know they can count on these programs from year to year. And then a lot of the programs, especially the federal grant funds that the Community Farm Alliance uses, require match. And in the worst case, I guess you'd say, it's a one-to-one match. So every federal dollar that we can pull down for this requires another dollar from state or private philanthropy. And, you know, that is honestly has been a big challenge for Community Farm Alliance to grow these programs. And then the other part is really the collecting the data, doing evaluation of the research, right? Because that research, you know, somebody said earlier, you know, in order to get good policy, you need the quantitative, which is the data, but you also need the qualitative, and that is the human element, you know, to these stories, which leads to the Healthy Farm and Food Innovation Fund, which I'm happy to say we're expecting to get introduced this week, and I will share the bill number for you. So what does that do? So it's going to create this state fund, right? That initially is to help offset these federal match requirements, but ultimately can do so much more to address, food security and nutrition security within the state. And I will share that with the network when it's dropped. And I hope when you are in Frankfurt that you will, put in your the legislative year your support for this bill. And so, some of the impacts, right? Again, I think it's kind of obvious, but it really will impact Kentucky's families. It certainly will help Kentucky farmers, and in the end, it's just really good economic for Kentucky. And I'm just going to touch briefly on, our efforts also include the national level. Some of you may be aware of the White House Conference on Hunger, Nutrition, Health that happened back in September. The Foundation for Healthy Kentucky and CFA did a listening session around this in Kentucky, and Kentuckians' input was moved on up and included in the national directives for how to approach this issue. And then just recently, I was honored to testify in DC to the Senate Agricultural Subcommittee on Food and Nutrition about food as medicine, specifically in Kentucky for this. And then, all this work, there's so many partners in this work. And for Community Farm Alliance, we are very appreciative of the support of each and every one of these partners. And that's it. Thank you all very much. I appreciate this opportunity, and I'm going to stop sharing. And I am going to also, because putting the face on issues, like it's been mentioned multiple times today, how it's important, but I just dropped in the chat a link to a report that we did about in Letcher County and directly about the impact at that county's level about increasing food access, and a lot of wonderful stories about folks who have, lowered their A1A or reduced weight or those kind of issues there. Happy to take any questions if we got time.
Are there any questions for Martin? Okay, I'll get started because we are in the final stretch. And I do want to conclude our virtual session today on time. I know everyone has other work to do, but a few key announcements before I turn things over to our final speaker. Check the chat for more links. Make plans to join us next Wednesday, February 15th for Diabetes Day at the Capitol, the in-person edition. We're back in person. Make appointments with your legislators in advance. Drop-ins typically don't work. They may, if your legislator knows you, or if you make friends with just the right person at the desk, but typically you need an appointment to see your legislator. The Capitol Annex is where we will be delivering packets and where you will be making your visits. So that is the building behind the Capitol. We will not be in the Capitol like we were in 2020. Actually, in 2020, we were back and forth. But room 130 from 8:30 to 9:30. Be prepared to wait in line to get into the annex and have photo ID available. Just be prepared to go through security, allow plenty of time, but we will be at room 130 giving out packets from 8:30 to 9:30. The link for registration, Terry has posted that in the chat several times, but you can click on that. If you don't get a chance to get there today, you can go to KDN's website and we have all of the information housed there. But the sooner we know how many will be attending, the sooner we can make plans, because we will try and pull together some information for those attending and making legislator visits. So we have a couple of pieces of legislation that are being introduced this week. Julie spoke to the PBM legislation. Martin has spoken to legislation related to access to healthy foods. This is so exciting. And what we will do as they communicate with us in the next week, we will work to have information specifically related to those bill numbers, so you can take those talking points and translate them more effectively to specific pieces of legislation, not just general information. Dr. Stack would say that's like buckshot, but we want to laser focus in on specific pieces of legislation and then illustrate the stories. And all of our speakers have done a phenomenal job of telling us how important those stories are, the patients we know, the people we've interacted with. We have the numbers, we have the one pager from our 2023 report yet to be released, but we have that one pager that gives us the data. Now let's go into our heads and come up with those stories that bring those numbers to life. It is now my pleasure to introduce Ben Chandler. He is the president and CEO of the Foundation for a Healthy Kentucky. And ever since we started on this virtual journey in 2021, they have been our partner in bringing our information to life and sharing it with you throughout the state. So it's now my pleasure to turn things over to Ben. Thank you so much for being with us today.
Well, thank you. Can you all hear me all right? Good. It's wonderful to be with you. And I of course, find this discussion about diabetes to be one that I've been involved in a long time, but one that I'm just keenly interested in, because I don't have to tell you all how big the problem is. And we're talking to a bunch of people who understand the enormity of this problem throughout the state of Kentucky and where we stand in rankings in terms of diabetes. And while we see those numbers, what those numbers mean are real people who are suffering, real families that are suffering, and the amount of money that this costs our economy in terms of productivity, in terms of the expenditure on healthcare, and the damage to quality of life is just really incalculable. You can attach numbers to it, but it all, in my view, is just incalculable. I find myself kind of the old man here now. It wasn't that long ago, I'm sorry to tell you all, when I was the young guy, and people would come see me, and I was learning, and I think back on it, and I remember it was almost 20 years ago that Julie's father, Bob, came into my office in Washington when I was in Congress. He had, among others, Stuart Perry and Larry Smith in tow, and they wanted to talk to me about diabetes. And this, as I say, was 20 years ago. I can't believe it's been that long. But we have been fighting this, and I've been a part of fighting this all of that time and longer. It's just, it's hard for me to believe, frankly, that we haven't gotten more done on the issue. But I think we're moving in the right direction. Of course, here I am, as I say, I'm the old guy. Now Julie is one of the experts in the field, and she actually interned in my office. So I can tell you, I have clearly been around this a long time. And I know that Connie, I've known Connie forever too. And Connie, she knows how important stories are. And you all have talked about that throughout this process, but I cannot emphasize enough how important it is not to just give your representatives data. Data is crucial. And don't get me wrong about that. You've got to have the data. You've got to have it to understand what needs to be done. And you've got to have the confidence to go in there and know that you're talking about the right thing and you're doing what's right. But you are going to make the biggest impact on your representatives when you can connect with them personally in some way. When you can hit a chord with those individuals, when you can somehow connect them to real life problems, real life stories that they're familiar with that face individuals that they represent in their own districts. If you can do that, and if you can do that in a compelling way, you can really have an incredible impact on this issue. And there are no shortage of stories, as you know. There are no stories of horror stories, frankly. You know, everybody here, when dealing with this issue, is on a mission of mercy of one sort or another. And we're trying to help people. We're trying to help family members often. We're trying to make a difference in the lives of our fellow citizens. And we all know people who have suffered, and we all can come up with stories. So it's very, very important that you make that personal connection, that you, when you go in to see your representative, tell these stories to them in a compelling manner. Let them know how much this means and how much it means to people's daily lives. You've got to keep it from being antiseptic. You've got to get it real to these folks, that they're familiar with the numbers, but their eyes glaze over sometimes when you just talk to them about numbers. But I can't emphasize enough to you how important constituent discussions with your legislators are. They really will listen, and they will particularly listen if you have some compelling stories to tell them, and it'll make a gigantic difference, and you can get the job done. I mean, things can happen on this subject. Danny Bentley can tell you all about it. And Danny used to come see me in Washington too, many years ago. And now Danny is in the legislature, and he's a champion for diabetes, for battling diabetes. And he's can't say enough about Danny. And I'm also very excited to see the alliance with Martin and what CFA is doing. They are doing such good work producing food, the right kind of food, healthy food, and we need to do more of that. You know how important that is to what we're talking about. So it all comes together. It all moves us in the right direction, I think, and I'm just as proud as I can be to be part of it, to be an advocate on your all's part. The Foundation for a Healthy Kentucky is all in on this subject. We want to do everything that we're big enough to do to help in the fight against diabetes. Again, because we know what's at stake here. It's our loved ones. It's the health of our Commonwealth. You know, it's a very, very, very big deal. But I want to thank everybody. I want to thank all of you for the hard work that you put in. And as I said before, it is a mission of mercy. You really are doing the Lord's work, and you're helping people who are really struggling in many cases. So please keep it up. Know that there are a lot of us who are with you and who are moving in the same direction. We're all in this together, and we've got to make progress. So thank you so much. And to the all of the folks who put this on, you can always count on us and our support, and we're going to be there to the very end. Good luck.
Thank you so much. Thanks to everyone who's attended today. One last call for questions. I believe all of our speakers are still on, so feel free to unmute and ask. I will take that then as a sign that we are good to adjourn. Thanks again to everyone for joining us today. We look forward to seeing you next Wednesday in Frankfort for Diabetes Day at the Capitol 2023. Safe travels.